This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
The Centers for Disease Control and Prevention reports, get this, 7 million Americans aged 65 or older are living with cancer. Many will have to undergo harsh treatments and surgeries, but there are ways to help improve the odds of treatment success. Here are 4 simple cancer-fighting strategies.
79-year-old Barbara Owen is a 2-time cancer survivor. First, it was a tumor on her kidney, then 3 years ago, lung cancer.
At the time it hit me, was sudden.
Her 90-year-old husband, Bill, was also diagnosed with lymphoma 5 years ago.
I stayed with him, and then he stayed with me.
How can you improve your survival odds? First, eat broccoli. A recent study found breast cancer survivors who consumed 150 grams of cruciferous veggies a day were 42% less likely to die from their cancer and 19% less likely to have a recurrence.
Cabbage and broccoli and cauliflower, all of these are the cruciferous vegetables, and they are so full of different, a gazillion phytochemicals that truly create that really inhospitable environment for cancer cells to grow, particularly breast cancer.
Also try turmeric supplements. A UCLA study showed the ingredient found in curry boosts the effects of chemo and helps slow cancer growth. Our third tip, strength training. Chemo can cause women to lose as much bone density in 1 year as the average woman would lose in 10. Our last tip, up your vitamin D. A Harvard study found lung cancer patients who had the highest intake of vitamin D more than doubled their survival rate after surgery. Barbara and Bill say staying active has helped them, but their biggest cancer-fighting weapon?
Just take care of one another.
Had a good wife.
And experts say make sure you talk to your doctor first about diet and exercise plans. You may have to modify your program or take it easy depending on what type of treatment you are receiving. Well, no matter what type of treatment you're receiving or what kind of cancer you may have, healthy living is key. And joining us to talk more about surviving cancer are Sheila Ramsey, Clinical Resource Coordinator in the Cardiac Vascular Pulmonary Rehab Department of PRMC, and Dr. Pam Pitt-Klug of Peninsula Oncology and Hematology. Thank you for joining us this afternoon. They were talking about exercise, and Sheila, I want to talk to you about that. You know, how much exercise do you need to do to beat the odds, or at least help you beat the odds?
Well, the American College of Sports Medicine currently recommends that most people engage in 30 to 60 minutes of moderate physical activity most days of the week. There is a strong link between lack of physical activity and obesity with especially breast cancer, colon cancer. So it's not just, being active, but that should help maintain a normal weight as well.
Right, right. And is it beneficial? They say it is beneficial to exercise during cancer treatments?
Yes, it is. Now, those guidelines may not suit the average cancer person. It really depends on the individual and where they're at in their treatment.
Now, you offer a cancer exercise program at PRMC. Tell me about that.
Well, it started about 2 years ago as a joint effort between the Cancer Institute and our department. We just felt like there was a need in the community to offer an exercise program for cancer patients. It does require a physician referral, and right now the program is designed so that their first visit is an assessment, which includes like a submaximal bike or treadmill test. They get measurements of body mass index, percent body fat, flexibility assessments, muscular strength and endurance, and from those results I formulate what we call an exercise prescription, and then they meet with me individually for training sessions or exercise sessions, and then at that point they can join our group exercise program, which is our adult fitness program. They can continue individualized sessions with me, or they can continue to exercise at home with some recommendations.
Right, and we have a number for more information on the cancer exercise program at PRMC, 410-543-7026. Dr. Klug, we were talking about seniors and cancer, and we heard the statistics. Does the age of the person have anything to do with the severity of the cancer they may have?
Answer is yes, definitely. When you age, you also have chance and risk to have cancer, and you have comorbidity, and the diagnosis may be a little bit later than usual, and then the complications of other situation. The patient usually would say, I'm too old to be treated. And the family would also say, well, we don't want the patient to suffer from the treatment. So there's a complex.
Yeah, we were talking about that. You know, people older may think that, you know, why bother going through all this chemo and everything? I'm so old. But you were saying that there are actually there's a lot of success in older patients.
Correct. We have been treating people way beyond 65 years of age, and there has been a looking for the elderly to participate in clinical trial because the senior usually don't get a chance to participate in the clinical trial. And now with all these things, so we can give better recommendation to our patient, you know, what chance you should get into remission, what kind of problem you would run into during the treatment. And they have to go and get exercise with Sheila.
Yeah.
And I think they're doing quite well.
Right.
And the age is not just the number. We assess their functionality.
Right, right. All right, thank you. Very good information, Dr. Klug and Sheila. Thank you for joining us this afternoon. Still to come on Delmarva Life, Brian dresses down and gets dirty with the folks from Walls Custom Concrete. Believe it or not, they let him help install custom concrete bordering. So how did he do? We'll tell you. We'll let you know when we come back. Stay tuned to Delmarva Life.